The importance of protein in bariatric surgical patients. It is important to understand protein and how it works in the body. Protein is the second most abundant substance in the body, with only water being more prevalent. It plays a number of roles, including as part of the immune system, making and maintaining the antibodies necessary to keep it up and running. There are also a number of other functions that protein plays in the body, including, speeds up wound healing, preserves lean muscle mass, enhances fat-burning metabolism, minimizes hair loss, keeps the hair, skin, nails and bone healthier, regulates hormones and enzymes that are important for a number of functions in the body. How protein helps after surgery. Surgery of every kind is traumatic to the body. Bariatric surgery may be even more stressful because it is performed on those who are mostly severely obese and may have a number of health conditions as well, including high blood pressure, heart conditions, diabetes and kidney disease. The protein that you eat will help your body to heal quickly after the surgery is completed. In addition, protein helps you to stay full between meals, which is vital for controlling the cravings between each meal. After your weight loss surgery, your stomach will be much smaller and the amount of food that you are able to eat will be much smaller as well. It is important then that every bite of food contributes to your overall good health. You simply cannot eat whatever you want, you must eat the foods that will give the vitamins and nutrients that you need. You will be given several rules to follow about the food that you eat, when you eat it and how much of it you can have. In addition to good and healthy foods, you will have to supplement your vitamin and your protein intake as well. There are a number of protein supplements that might be suggested to you. Do you know how much protein you will need? Because protein is so important, you need to make sure that you are getting the right amount of it. While you do need to make sure that you are getting enough protein, you also need to make sure that the amount that you are consuming is not too much for your own needs. Before your surgery is completed, you may not need quite as much protein, but afterward your need will increase as your body works to heal and adjust to the new way of eating. Protein is also helpful because it boosts your metabolism and can help you to eat less during the day. One of the first things that will happen when you are consulting with a surgeon for bariatric surgery is a visit to the nutritionist or dietitian so that you can get a good idea of what to expect after the surgery and to identify where you need more education. Not all patients are aware of how much of each nutrient that they need, nor do they all know which nutrients are the most important. The nutritionist will help devise the best eating plan for you so that you get all of the nutrients that you need without eating too many calories. The nutritionist will also discuss the foods that are highest in protein but still low in calories. Protein either comes from animal or plant sources. Animal-based proteins are complete, meaning that they have all of the essential amino acids. Plant proteins, with the exception of soy, are not complete, meaning that they are lacking one or more of these essential amino acids. The body itself is made up of thousands of different proteins and is not able to store or produce these amino acids, so it must have a fresh supply every day. While animal proteins are complete, they also tend to have higher calorie counts and are higher in fat as well. Plant proteins tend to have less calories and less fat, especially saturated fats. Before you get started on your diet, a nutritionist will help to determine how much protein you need and how many calories your overall daily diet should have. After your surgery, your protein needs may be as high as 55 to 100 grams per day, but will drop slowly as you recover and as you lose weight. Why supplements are important and how to choose them. In most types of weight loss surgery, the stomach is reduced to a fraction of its normal size. It is important to keep in mind that although the stomach can stretch, after surgery its capacity will be no more than a few ounces. There are a few rules that you will have to keep in mind as well. For instance, immediately after your surgery, you will be living on liquids as you recover. After that, you will gradually add soft foods and then regular foods in small amounts. You will not be able to eat your meals and drink a beverage at the same time and will have to turn your medications and supplements as well. The supplements that you take will have to be selected carefully, as some types are too high in sugar and may be too large to be right for you. There are other types of protein supplements that might be better, not only because they are smaller in size but because of the high-quality protein that they provide. ProfectR, a protein supplement from Protica, is less than 3 fluid ounces in size but provides 25 grams of protein per serving. It is available in a number of fruit-based flavors. Weight loss surgery and protein, a case study. Chris was more than 180 pounds overweight when he went to the doctor for help. His health numbers were not the best despite his fairly young age. The doctor was concerned and suggested that he had bariatric surgery. He explained the procedure to Chris and also explained what will happen afterward. In addition, Chris was sent to the nutritionist who explained what he will be eating, how much he will be allowed to eat and what his body actually needs for good health. In addition, the nutritionist gave Chris a quiz which showed him how much he does not know about healthy eating and then gave him information so that he could read up on it. After his surgery, Chris's protein needs were higher as he worked to heal from the incision itself and as he worked to become more active. He has been sedentary for far too long, and he knows that he will have to move around more so that he can be healthier. In addition to vitamins and the medications that he will be taking, he will have to use a protein supplement so that he makes sure that he is getting the right amount. Chris knows that he will need to keep track of the foods that he eats every day, not only because he wants to lose weight but because if he overeats now he increases the risk of surgical complications.